Inflammatory arthritis refers to a group of conditions which affect the joints and related structures. Inflammatory conditions are a type of autoimmune disease in that the body's own immune system mistakenly attacks its own tissue. I'm certain most of us have all heard of arthritis, but not only can this be divided down into subtypes, but there are also a range of related illnesses that fall under this broad category. This video is going to give a brief overview of some of the more common ones and what to expect. When one thinks of arthritis, the two main types people tend to be aware of are osteoarthritis and rheumatoid arthritis. Osteoarthritis is a condition which causes the joints to become painful and stiff and is most typically associated with the wear and tear characteristically seen in older individuals. Osteoarthritis is not a form of inflammatory arthritis, however we will explore it briefly here for full context. Most clinicians will refer to rheumatoid arthritis as inflammatory arthritis and osteoarthritis as non-inflammatory arthritis, so it's relatively easy to remember that this is not a form of inflammatory arthritis. In osteoarthritis, the protective cartilage on the ends of one's bones break down, causing pain, swelling, and difficulty moving the joints. Bony growths can develop, and the area can become red and swollen. These bony growths are known as osteophytes, or bone spurs, bony lumps that grow on the bones in the spine or around joints. The exact cause is not known, but factors such as joint injury, being overweight, advanced age, and being female all increase the risk of osteoarthritis. It can cause swelling either unilaterally or bilaterally. There is no cure. Lifestyle managements, such as maintaining a healthy weight and exercising regularly, can not only reduce symptoms, but are also the best way for individuals to reduce the chance of the illness presenting to begin with. Paracetamol can help to deal with the pain, and in more serious cases, opioids such as codeine and cocodamol can be used. Non-steroidal anti-inflammatory drugs are taken in more extreme cases. These can be taken as a topical cream or orally, which are usually prescribed alongside a proton pump inhibitor. Surgery is usually only considered when all other options have been exhausted and have failed to alleviate the symptoms owing to the inherent risk involved in surgery. Rheumatoid arthritis is a form of autoimmune disease that causes chronic inflammation, usually around the joints, but can also affect the skin, eyes, lungs, heart, and blood vessels. Whilst the exact mechanism is not fully understood, a genetic component seems likely, either directly or triggered because of environmental factors, such as infection with certain viruses and bacteria. Unlike osteoarthritis, rheumatoid arthritis affects the linings of your joints, causing painful swelling that can result in bone erosion and joint deformity. In most cases, symptoms occur in the same joints on both sides of the body. Symptoms unilaterally is usually more indicative of osteoarthritis in most cases. The most common treatment option is the use of disease-modifying anti-rheumatic drugs, or DMARDs, to ease the symptoms of the condition and slow down its progression. DMARDs work by blocking the effects of chemicals released when the immune system attacks the joints, which could otherwise cause further damage to nearby bones, tendons, ligaments, and cartilage. Methotrexate is usually the first medicine given for rheumatoid arthritis, often with another DMARD and a short course of corticosteroids to relieve any pain. Side effects of these can affect blood cells and liver function, so regular blood tests are performed to monitor the progression. Less commonly, methotrexate can affect the lungs, so you may have to have a chest X-ray and possibly a pulmonary function test when one starts the medication. It can take a few months to notice a DMARD working, so constant monitoring is required. Lupus erythematosus is something you may have heard of if you have ever watched House.
You stash your drugs in a lupus textbook. It's never lupus.
Lupus is an autoimmune disease more commonly seen in Black and Asian populations. The exact causes are not fully understood, but possible causes include viral infections, childbirth, puberty, and menopause. Lupus is a long-term condition that causes joint pain, skin rashes, and lethargy. There is no cure, although symptoms can be managed with medications such as ibuprofen, hydroxychloroquine, and steroid injections. Rituximab and belimumab are sometimes used to treat severe lupus. These work on the immune system to reduce the number of antibodies in the blood. Flare-up relapses are common, where the symptoms become worse for a few weeks or even months. Symptoms then typically settle down into remission. The most common treatment here is non-steroidal anti-inflammatory drugs, or NSAIDs. Over-the-counter NSAIDs, such as ibuprofen and naproxen, help reduce mild pain and swelling in joints and muscles. In more severe cases, corticosteroids, such as prednisone, may be used to help reduce swelling, tenderness, and pain. In high doses, these can calm the immune system, which is what we want, but also requires monitoring to make sure it does not lead to secondary infections. A high initial dose is usually started, and afterwards this will be lowered until it is no longer required. Whilst it might seem strange at a glance, in some cases, anti-malarial drugs are used. These drugs, which are commonly used to treat malaria, also help to treat joint pain, skin rashes, fatigue, and lung inflammation. Two common anti-malarial medicines are hydroxychloroquine and chloroquine phosphate. Studies have found that taking anti-malarial medicines can stop lupus flare-ups and may help people with lupus to live longer. Gout is a form of arthritis which causes sudden and severe joint pain. In days past, gout was often considered a rich man's disease, or the disease of kings, and there's a reason for this. The prevalence of gout is increased in those who are overweight and those who consume a large amount of fatty foods, something not possible for the lower classes in days of old. As such, the best way to avoid gout prophylactically is to maintain a healthy weight, eat a balanced diet, drink plenty of fluids, exercise regularly, and not smoke. Other causes include genetics, as gout can run in the family. It is more common in men, especially those taking diuretics or ACE inhibitors, as well as women who have undergone menopause. Gout is caused by monosodium urate monohydrate crystals, substances that should normally be dissolved in the blood, which instead form chalky white materials in tissues. When macrophages try to digest these crystals, they release toxins leading to inflammation. These instances are known as crystalline atrophies. Gout is most common in middle-aged men and usually starts in the large toe, a condition known as podagra. It is usually treated with non-steroidal anti-inflammatory drugs. Those who experience frequent flare-ups or high levels of uric acid in the blood may also be prescribed uric acid lowering medicine. Pseudogout is a form of arthritis characterized by sudden, painful swelling in one or more of the joints. Episodes can last for days or weeks and was formerly known as calcium pyrophosphate deposition disease, or CPPD. It is now commonly referred to as pseudogout, owing to its similarity to gout. In both pseudogout and gout, crystal deposits form within the joint, although the type of crystal differs from each condition. In gout, urate crystals form. In pseudogout, it is calcium pyrophosphate crystals. Gout causes these needle-like crystals, whereas pseudogout crystals form a more rhomboid shape. As such, the most common way to differentiate between the two diseases is to perform an aspiration and look for the crystals using microscopy. Treatment options include steroidal injections, anti-inflammatory medication, as well as colchicine daily as a preventative measure. Psoriatic arthritis is a type of condition which affects individuals who suffer from the skin condition psoriasis. Approximately 1/3 of those who suffer from psoriasis also suffer from psoriatic arthritis, which tends to develop 5 to 10 years after a psoriasis diagnosis. Psoriasis itself causes red patches of skin topped by silvery scales. Having psoriatic arthritis increases one's risk of secondary conditions, in particular cardiovascular disease. Often blood pressure and cholesterol tests are carried out to rule out the exacerbation of secondary illnesses. Treatment options include non-steroidal anti-inflammatory drugs, corticosteroids, and disease-modifying anti-rheumatic drugs. Biological treatments represent a newer form of treatment that may be offered if DMARDs prove ineffective. Biological treatments work by stopping signaling, which leads to immune system activation. Individuals require blood or urine tests to check for any adverse side effects, as they can increase the risk of infection, as well as damage organs such as the liver and kidneys. As such treatments are rarely continued for more than 3 months before other options are considered. This has been a brief rundown of some of the more common types of inflammatory arthritis that exist. There are others out there, and I always encourage you to conduct further research and seek out other videos. For now though, that is all from me. Thank you very much for watching.